Well, thank you very much. I appreciate being asked to come and speak. And there are a couple of issues that I really wanted to talk to you about, but I wanted to actually share some solutions that we have used as well. Community support services. We believe that everyone deserves the opportunity to live independently in their own home for as long as possible. Home care and community support services allows people to safely meet their unique needs, be more independent and resilient, and live the way they want to live for longer. These cost-effective services reduce the needs for more expensive hospital care, emergency room visits, or long-term care. They benefit individual clients, their caregivers, and the healthcare system as a whole. So our focus is on promoting independent living through transportation, meals and wheels and nutrition, education and supports, safety and reassurance, health and wellness, support in the home, intensive support programs, and adult day services. And I wanted to share a story, a real-life story, about a 92-year-old lady living with her husband in our community in her own home. This lady had a stroke and resulted in right side weakness. She had foot drop, she walked with a walker, and she was taking care of her husband. Her husband was 96, and she was doing an awesome job taking care of him who was at home. He had diabetes, so she was managing all of his diabetes medication and how he ate. She was checking his sugars, reminding him of his pills, and keeping him on target. Then she had a bad year. She got pneumonia, had a hard time bouncing back, and she was in and out of hospital for approximately 6 months. So for in the course of a year, she was in hospital, in, out, for about 6 months, and came home with a feeding tube, oxygen, and really not sure what to do. So we came along. Our assisted living program came in. She came on our program, actually. She was referred to, and she was referred to us and came on our program, and immediately needed our service. Wraparound care is what we were looking at. So we had community nursing come in and address the meds in her feeding tube. She received PSW staff, regularly visits and unscheduled visits daily. Her husband was tended to as well. And what we did was we sat down with her and we developed a plan. She had goals, and we wanted to coordinate those plans, those goals with her. So we developed a client-directed plan, which simple goals as she wanted to be able to go to church. And that was a very important goal for her, so she wanted to be able to walk the few steps in order to get to the elevator to get into church. And that was a very big goal for her. And we wanted to help her achieve that. So again, PSWs coming in to care for her, coming in and providing exercise programs, walking her up to coffee, and doing one-on-one care with her. Being social with her. She had a lot of anxiety over her oxygen, on portable oxygen, and how that would happen, and all of that. So they provided different exercises for her and different techniques to kind of combat the anxiety that she would be, that she had on a regular basis. And she overcame that. That was something that was pretty awesome. So the PSW team, the assisted living team, also with the community nurses, came around this family and saw what we could do to help her. Reassurance, checking her tubes, generally allowing her to be more comfortable and being able to allow her to get back to helping her husband, which she was doing quite well. She had challenges, yes. She had setbacks, yes. But I have to tell you that she stayed. So year 1, she was in hospital in and out, approximately 6 months. Year 2, 365 days of 0 hospital visits. And that was really because of the care that was provided for her along beside her. So we kind of wrapped around her and gave her all the needs, all the services that she needed. She received Meals on Wheels in the home. She received transportation when she needed to go, when she wanted to go visit her family. We provided volunteer transportation for her. Friendly visiting, and all the caregiving that she needed. So the whole programs of community support services wrapped around this lady and gave her the success that she needed. So that's a great way of using the dollars properly, I believe, to keep people in their own homes as long as possible. That's a success story. Another gentleman on ODSP in the same community, and we're a rural community way out in West Lorne. I don't know if everybody knows where West Lorne is, but way out in the rural area, getting into any kind of appointments, specialized appointments in London is usually about 120 kilometers round trip, which means that's a lot of money on someone who is paying for transportation, who does not have a vehicle or has no access to any other transportation. Our program provides volunteer transportation, which is provided, obviously by volunteers in our community, and so the client is able to receive the transportation to get to the appointments. Is it a barrier? Yes, there's a big barrier. The cost is usually a big factor. Usually about a round trip costs between $50 to $60. And so if someone is coming into the city 1 or 2 times a month, that is a huge amount out of somebody who's receiving Ontario disability. So that's a huge cost that we need to see changed. There's no other services out our way. There is actually a taxi service, and that is like triple the cost if they wanted to get into the city. So what happens if they can't get in? They're not going to the appointments. They have no money to pay for the transportation. They are not going to the appointments, and then therefore they're not able to get the care that they need, and oftentimes end up in ER. That's usually what happens. But this gentleman, a success in our own community. Again, we are looking at wraparound care for him, and provided a coordinated care plan, which he was seeing a neurologist, a cardiologist, a mental health team, diabetes nurse, as well as the assisted living program as well, that came around him. So this young fellow was able to have a whole team around him. Keep him out of the ER. He suffered from mental health. He suffers from mental health, and would often be in the ER. So this type of coordinated care plan wrapped around him, provided the transportation that he needed. So we received funding from Elgin. London Elgin United Way with special funding for the Gift a Ride program, which we were able to access and provide transportation for him to come into London and go to his appointments. Also, we were able to identify some of his needs, social needs, even the need to be able to go uptown and provide and to get his own groceries, and to have the freedom to go out and about. And so with the Community Services Flex Fund, we were able to access some funding for him in order to get a tricycle for him, a trike. So he goes around town. He is able to be independent. He is succeeding. He is having the health care that he needs. That's a really great model on how community partners wrap around someone to keep them in their own home longer, and not only longer, but successful and healthy and strong. And so transportation in our area, yes, huge issue. We have no access to public transportation, and so we're totally relying on volunteers. Our volunteers are aging. Most of our volunteers are in their 70s and 80s, and we desperately need something happening in the rural areas. So that is a big push for us to push with transportation, but also pushing with the challenging of PSW staffing, because with the PSW staffing, we want to be able to provide, we want to be present. It's not just assembly line, task. We want to be present. And so when we have PSWs going into a home and providing the care, and the care that is whole care for a client or a person, we want to be able to provide that, and we need the funding. We need as we know that we're in a PSW crisis at the moment, and we need desperately to do something about that. We're looking at creative ways of partnering with communities and just different ways of bringing different PSW models. So we're looking at community partnerships, we're sharing different staff models, we're looking at incorporating and adults with disabilities, and using the supports and using the folks that we have around us, and really looking at partnering better, because the system that is now, it's not really working. So we have to get our thinking caps on and really think beyond what we're doing now. And that's what we're doing. We are looking at different models and different ways of providing PSW care in our area. So we're open for more ideas. We have great people who are wanting to talk further with us, and I think I'm done. I think you can. So thank you very much.